Welcome back to the Deep Dive. I'm your AI host. Great to have you with us.
And I'm Dr. AI. It's fantastic to be here again.
So today we're diving into something really fundamental about AI.
That's right. We're looking under the hood, figuring out how we actually know if an AI model is, well, any good.
Exactly. And I wanted to kick things off with a question for everyone listening. Imagine an AI model says it has 95% accuracy. Your first thought is probably, wow, that's amazing, super reliable, right?
Yeah, most people would think that. I mean, 95% sounds fantastic on the surface.
It really does. We just see that high number and think, job done.
But that's the core paradox we're getting into today. While 95% sounds great evaluating AI models, it's much more complicated than just one number.
Like judging a book by its cover, sort of?
Kind of, yeah. Or maybe like judging a chef only on how fast they chop vegetables. Speed's good, but what about taste, presentation, creativity? You need the whole picture.
Okay, that makes sense. So our mission for this deep dive is to unpack why accuracy isn't the whole story. We'll explore some other really crucial ways to measure performance.
And help you figure out how to really tell if an AI model is actually effective, out there in the real world.
It's about understanding what these numbers mean.
Precisely. Which brings us to a pretty basic question. Why do we even need to evaluate models so deeply? If it seems to work okay, why not just use it?
Yeah, that's what I wonder sometimes. If it gets things right most of the time, isn't that good enough? Why all the extra metrics?
Well, it's because AI models learn patterns from the data we feed them, but sometimes they learn the wrong things or learn things too specifically.
How so?
One big issue is something called overfitting. This is where the model basically memorizes the training data. It gets so good at recognizing the exact examples it saw during training
That it can't handle anything new.
Exactly. It struggles to generalize, put it in front of new data, even slightly different data, and its performance just tanks.
Ah, okay. It's like cramming for a test by just memorizing answers. You might ace that test, but ask a slightly different question.
You're stuck, yeah. Or models can develop bias. This often happens because the training data itself wasn't balanced. Maybe it underrepresented certain groups or overrepresented others. The model just learns to favor whatever pattern was dominant in the data it saw.
So even if a model seems accurate overall, it could be making systematic errors because of overfitting or bias, and that single accuracy number wouldn't show it.
Right. And the impact of those errors varies wildly. Think about it. An AI misidentifies your cat picture as a dog. Annoying, maybe. A bit funny, sure. But, no big deal, right?
Right, low stakes.
But now imagine a medical AI. Let's say it's looking at scans. If it misses a cancerous tumor, classifies it as healthy, that's a false negative. The consequences there are potentially devastating.
Wow. Yeah, that's a completely different world of impact. One's an inconvenience, the other's life or death.
Exactly. So different tasks have vastly different tolerances for error. You just can't use the same yardstick for a photo app and a medical diagnostic tool. That single accuracy score, it's just not enough when the stakes are high.
Okay, that really clarifies why we need more. So if accuracy isn't the full picture, how do we start getting a better view? How do we see where it's going wrong?
The foundational tool for this, really the starting point, is something called the confusion matrix.
Confusion matrix.
Yeah.
Sounds confusing.
Yeah, the name's a bit ironic, but it's actually designed to reduce confusion. Think of it as a simple table. It visually breaks down a model's predictions into 4 key categories.
Okay.
It helps us see exactly how the model is performing, both correctly and incorrectly.
Okay, a visual table. What are these 4 categories it shows us?
Right, so it splits everything into first TP, or a true positive. This is when the model correctly says yes and the answer is actually yes, like it detects a disease and the patient does have the disease. That's a hit. Good outcome.
Got it. Correct positive.
Then, FP or false positive. This is when the model incorrectly says yes, but the answer is actually no. It raises a false alarm. Like, it says disease, but the patient is healthy.
Okay, false alarm, unnecessary worry, maybe extra tests.
Exactly. Third, TN or true negative. This is when the model correctly says no and the answer is no. It says no disease and the patient is healthy. Another good outcome.
Right, correct negative.
And finally, FN, or false negative. This is the tricky one. The model incorrectly says no, but the answer is actually yes. It misses something important, like it says no disease, but the patient does have it. This is often the most dangerous type of error.
Oh, the miss. Yeah, I can see how TP, FK, TN, FN gives you way more detail than just right or wrong. So how do these 4 numbers lead to the other metrics you mentioned earlier?
Great question. These 4 values are the building blocks. Let's go back to accuracy for a second. Using these terms, accuracy is just TP plus TN divided by the total number of cases, TP plus FP plus TN plus FN.
So all the correct predictions divided by everything.
Yep. And like we said, it's fine when your classes are balanced, like 50% cats, 50% dogs. Accuracy works pretty well there.
But what about when they're not balanced? Like your rare disease example.
That's exactly where precision and recall become absolutely vital. Let's take precision first. Think of it as asking, of all the times the model predicted positive, how often was it actually correct?
So when it did raise the alarm, how often was it a real alarm versus a false one?
Precisely. Using the medical example. Of everyone the model flagged as having the disease, what percentage really had it? High precision is crucial when the cost of a false positive is high. You want to avoid unnecessary treatments or panic, right?
Right, like in spam filters. You want high precision so important emails don't end up in the spam folder by mistake.
Perfect example. Now, recall. This looks at it from the other side. It asks, of all the actual positive cases that existed, how many did the model successfully find?
So this is out not missing anything important.
Exactly. Back to the medical scenario. Of all the patients who genuinely had the disease, what percentage did our model correctly identify? High recall is critical when the cost of a false negative missing a real case is very high. You absolutely cannot afford to miss a diagnosis.
Okay, so precision is about the accuracy of the positive predictions you make. Recall is about finding all the positive cases that are actually there. They seem almost like they're pulling in opposite directions sometimes.
They often are. Improving one can sometimes hurt the other. That's the trade-off. And that's where the F1 score comes in.
Oh, the F1, what does that do?
You basically hit the nail on the head earlier. The F1 score tries to find a balance between precision and recall. It's what's called the harmonic mean of the two.
Harmonic mean, why not just average them?
Well, the harmonic mean gives more weight to the lower value. So if either precision or recall is very low, the F1 score will also be low. It penalizes models that are extremely unbalanced, even if one metric looks good. It's useful when you want a single number that considers both avoiding false alarms and avoiding misses, especially with unbalanced data.
Okay, that makes sense. It forces a compromise. But I'm still stuck on that why. Can we revisit that disease example?
Yeah.
Show me again how that 95% or even 99% accuracy can just completely fall apart.
Absolutely. It's such a critical illustration. So let's set it up again. We're detecting a very rare disease. Only 1% of the population has it.
Okay, 1 in 100 people are actually sick, 99 are healthy.
Right. Now, imagine we build a really, really simple model, a lazy model even. All it does, its only trick is to predict no disease for every single person.
Just says healthy, healthy, healthy constantly. Doesn't even look at the data.
Pretty much. Now, what's its accuracy?
Well, it's right for the 99 healthy people and wrong for the one sick person. So 99 out of 100 correct, 99% accuracy.
Bingo! 99% accuracy. Sounds fantastic, right? You'd put that in a report, looks like you've built an amazing model.
Yeah, you'd be tempted to deploy it straight away based on that number.
But think about what it actually does. Is it useful for finding sick people?
No. It misses every single one.
Yeah.
It has zero ability to detect the disease. It's completely useless for its intended purpose.
Exactly. Despite that stellar accuracy score, the model fails utterly at the actual task. This just hammers home the point. High accuracy doesn't automatically mean high value or utility.
So this really drives home that choosing the right metric depends entirely on what you need the model to do. The task objective, as you called it.
Precisely. If your main goal is high precision, maybe you're filtering spam or recommending products you want to minimize those false alarms, make sure your positive predictions are solid.
Don't annoy the user with bad recommendations or sending good emails to junk.
Right. But if your goal is high recall, like in disease screening or maybe detecting fraudulent transactions, you absolutely have to minimize the misses. You'd rather investigate a few false alarms, low precision, than let a single critical case slip through, low recall.
Okay, the picture is much, much clearer now. Accuracy, precision, recall, F1. They all tell different parts of the story. But are there even more ways, like to get an even deeper, more robust understanding of how a model behaves?
Oh, absolutely. There are more advanced techniques that give us a richer view.
Like what?
Well, one very common pair is the ROC curve and AUC, which stands for area under the curve.
ROC and AUC, what do they tell us?
So instead of just one snapshot based on a single decision threshold, the ROC curve visualizes the model's performance across all possible thresholds. It plots the true positive rate against the false positive rate.
So like how many real cases you catch versus how many false alarms you trigger as you become more or less strict about making a positive prediction.
Exactly. It shows you the trade-off. And the AUC, the area under that curve, gives you a single number summarizing the model's overall ability to distinguish between positive and negative cases, regardless of the specific threshold chosen. A higher AUC generally means a better model at separating the classes.
Okay, so that gives a more global view of its classification power. What else?
Another crucial technique is cross-validation. Remember we talked about overfitting, how a model might look great on the data it was trained on, but fail on new data.
Yeah, the memorization problem.
Cross-validation helps combat that. The idea is to split your data into multiple parts, or folds. You train the model on some folds and test it on a fold it hasn't seen. Then you rotate which fold is used for testing. You repeat this process several times.
Ah, so you're testing it on different slices of the data each time.
Right. It ensures the model's performance is consistent and not just a lucky fluke on one particular test set. It gives you a much more reliable estimate of how well it will actually perform on truly unseen real-world data. It helps prevent those nasty surprises when a model that aced testing suddenly fails in production.
That sounds incredibly important for building trust in a model. Okay, ROCAUC, cross-validation. Anything else?
Yes, and this one is often overlooked but is incredibly important. Business metrics.
Business metrics. So moving beyond the technical stuff.
Exactly. This is about connecting the model's performance directly back to the real world. How does it actually impact the organization's goals? Does it save money? Does it increase revenue? Does it reduce risks?
So like quantifying the cost of errors.
Precisely. What's the actual cost of a false positive in this specific application? What's the cost of a false negative? For example, in loan applications, approving a bad loan, FP, costs money directly. Rejecting a good customer, FN, means lost potential revenue. You need to measure the model's impact in those real-world terms.
So you might choose a model with a slightly lower F1 score if it performs much better on the crucial business metric, like minimizing financial loss.
Absolutely. Ultimately, you need to verify if the model truly meets the practical requirements and delivers tangible value, not just good technical scores.
Wow. Okay, so it's not just about the math, it's about the context, the purpose, and the real-world impact. These advanced methods give a much more complete, comprehensive understanding.
That's really the core philosophy here. Evaluating an AI model isn't about hunting for one perfect number. It's about intelligently combining multiple indicators: accuracy, precision, recall, AUC, cross-validation results, business impact, and making an informed judgment based on the specific job the AI needs to do.
Looking at the whole dashboard, not just the speedometer.
Couldn't have said it better myself.
So a challenge then for everyone listening, the next time you hear about an AI model's performance, don't just ask, how accurate is it? Ask, what does that accuracy mean in this context? What are the precision and recall? What are the potential costs of its errors? Can it actually do its job effectively?
Yeah, and there's that stark little quote that sums it up, maybe a bit darkly. AI accuracy, 99% looks great, but that 1% could be a patient's life.
Oof, yeah. That really puts it in perspective. Context is absolutely everything.
It truly is.
Well, this has been incredibly illuminating. Thank you for breaking down such a complex but vital topic. And speaking of the bigger picture, on our next deep dive, we're going to follow the journey further. We'll be exploring from model to application, the complete AI process.
Sounds great, looking at how these evaluated models actually get deployed and start doing work in the world.
Exactly. So that brings us to the end of this deep dive. Dr. AI, thanks again for sharing your expertise.
Always a pleasure. Keep asking those critical questions.
And to all of you listening, thank you for joining us. If you found this valuable, please subscribe so you don't miss our future explorations. We'll see you on the next deep dive.